I'm going to talk a little bit about wound healing, and this is from the standpoint of not the latest and greatest aspects of wound healing and how to help it, but more from the standpoint of what I deal with. And I tend to work on underserved populations in areas where animals are not going to be in a hospital, they're not going to get a $60 blue pad on their little tiny wound every day, and they're not going to have even a lot of human touch in some cases. And the reason I'm going to bring that up is because quite often the discussion of wound healing goes to what you can do to make it heal really fast. And then after a while, what happens is the idea comes down that if you don't do all these things, you're under-treating the wound and it's never going to heal, and you're a bad owner, or you're a bad veterinarian, or a bad manager. And that, in fact, is not true. Large herbivores, equids, both horses and donkeys, are enormously good at healing wounds on their own. Really good at it. And we go out there as veterinarians and pat ourselves on the back and say, you know, I did this great super job of healing that wound. It's probably going to heal anyway. And if you look at any lay publication, you'll find all kinds of lotions and potions and this, that, and the other thing you can put on a wound, and it shows a picture of horrible wound on day one, completely healed wound 3 months later. I was probably going to do that anyway. So I don't want to suggest that we need to be irresponsible with wound treatment, but I want to give you an idea about how you can handle wounds without going broke and without panicking. Okay? And Javier's discussion of habronemiasis and my related question about sarcoids apply to wounds too, because those are probably the two biggest skin problems that we see in donkeys. And they are basically wound related, because that's how the parasite, or in the case of sarcoids, the virus, gets into the skin and causes the lesion. So this is, like I say, underserved areas. This is taking a bullet out of a horse in rural Guatemala. Dr. Dave Turoff looking on. Cindy probably running anesthesia. We do have a rope on the horse's leg, but that's just so it stays out of our way. He's well anesthetized. And so what is the goal when we're trying to do wound healing under circumstances like this? The headlamp in the dark. I believe that's on the Standing Rock Reservation. Horse has a probably see that bandage on its leg down there. These are animals that are intractable, can't be hospitalized. Ideal supplies are unavailable. And bandages are certainly wonderful things, and they can be really valuable in wound healing, but they can be a double-edged sword too. Outside of expense, when they're improperly applied, and when you're dealing with a situation where you have either help or clients, if you're a veterinarian that cannot properly maintain bandages, they can make the situation far worse. So I would rather have something unbandaged than to have a bad bandage on. Lack of money, lack of available supplies is not an excuse to throw up your hands and do nothing, on the other hand. There are certainly wounds and situations that require some degree of serious care. This is an example. This is a really deep wound going down to the collateral cartilages. This is a horse that was completely intractable in a situation where we were not going to be able to change a bandage on this leg. And what we're doing here is what's called a regional limb perfusion. You can see there's a tourniquet on the leg, and we're going to put a high level, 1,000-fold what you could get with an intramuscular injection into that tissue. And we found these to be enormously effective even when they can only be given intermittently. It does take some effort. In this case, it also took a good headlamp. For whatever reason, a lot of my pictures involve doing things with headlamps, so I need to change my contract or something. And this is a simple kit. Nothing here is particularly expensive. It's easily available. And if you're going to throw up your hand and say, well, you know, gee, I can't do this, I can't afford it, you better not be staying overnight in a hotel. Because you can't afford it. You might cut down on the Starbucks coffee and that kind of thing, and perhaps it'll make it more affordable. So what does actual healing mean? It's pretty simple. Basically, we want to cover deep tissues with skin. That's the way the body is supposed to operate. We want the limb to regain function, first of all, for adequate quality of life. And there are instances where adequate quality of life will not happen after healing, and that's a situation where you might need to consider euthanasia, unfortunately. And at times, economic usefulness. I would prefer that an injured animal may be able to be retired, but if you're talking about rural Mexico or Nicaragua, that horse or that burro, if it can't work for its owner, it has no value and it will not be well cared for. So I need to make it so it will be able to work again. Obviously, we want to end pain. Covering tissues, covering nerve endings with skin in the healing process is important, and you want it to be done in a way that avoids chronic pain. And then, of course, the reason that we have skin to begin with, well, there's several reasons, but certainly one of them is it keeps the microbes out of our bloodstream and so forth. So those are things that need to happen to have functional healing. There's some things that won't heal on their own. And I don't want you coming out of here saying, Davis says you can rub buffalo dung on every wound that ever occurred and the animal's going to get better. That's not true, obviously. Very large masses of skin that have been removed, and I've seen burn injuries and that sort of thing where literally, you know, all the skin on a hindquarter was gone. I mean, that's going to be very difficult to heal without some really serious care. An open synovial structure. What's a synovial structure? That's a joint or a tendon sheath. A joint or a tendon sheath. And the reason for that is that if those are not healed closed, the immune system does not have good access to them. They will become infected. They will cause great pain and complete lack of function of that limb, and usually lack of quality of life in the animal. Obviously, an unstable fracture in an animal that weighs over about 20 pounds, although I have my burro, Rosie, at home, healed a radial fracture. Okay, that's the big bone in the forearm of the horse. Her leg kind of points that way. She healed that all by her little old self out there in Mesquite, somewhere in Mexico. And when I found her, she had basically a healed fracture. Radial fractures in veterinary medicine in horses and in larger animals are rarely healed in surgery. She managed to just do it all by herself. But generally, those are things that require some degree of fairly intensive care. An open thorax or an open abdomen, a hole that goes into the chest or a hole that goes into the abdomen. That's going to result in pleuritis, lung collapse, or peritonitis. Those are things that you're not going to be able to take care of by putting a little bit of honey on it or something like that. Open central nervous system, injuries to the head, to the calvarium, where the central nervous system is involved. And a wound with an overwhelming amount of contaminated material. Although it takes an awful lot of dirt in a wound to make it unhealable, and we'll talk about why in a minute. Wounds want to heal. That thing looks really icky, right? It's above, it's above the hock. It's up in muscular tissue that has a lot of good blood supply. That's going to heal. I mean, you can make it heal faster or slower, but that's going to heal. So what happens in wounds immediately after an injury? And this applies to virtually all wounds. Okay, I'm going to hopefully have a hip replacement here in about a month. And that's going to be done in a laminar flow room. It's all going to be very sterile. But they're going to have to kind of hold my skin to get to the neck of my femur, and I'll whack the thing off and put a piece of iron in there. That wound is going to have to heal. It is going to go through the same steps that wound is going to go through. They'll happen a lot faster, I hope, with proper wound closure. But basically the process is the same, and I'm just going to take a minute to go over this because these are things that quite often are poorly understood, sometimes even by veterinarians, but certainly they don't get publicized to the general public. So the first thing that's going to happen is a process of hemostasis. The first thing is the skin gets cut, deeper tissues get injured, blood vessels are cut, blood is coming out, the body has to conserve that in some way, and so there's a clotting system that causes that to happen, and that's called hemostasis. And the blood vessels close up, they contract, there's some chemical processes that go on that stops the bleeding. And then, almost immediately after that, there's a process of inflammation. I mean, we think of inflammation as a terrible thing. We want to stop inflammation. We want to control inflammation. We want to take anti-inflammatory drugs. Inflammation is a really good thing. It's a really good thing. If you didn't have inflammation, every time you got a cut, you would get a terminal infection. And that starts immediately after wounding and hemostasis. As part of that, you have a front line of white blood cells that go in there, attack invading organisms. You have other cells that go in there and clean up the cellular debris, the tissues that were damaged, the dirt, the sand, the manure, the whatever it is that was jammed into the wound, and the body starts digesting those things. It starts pushing them out, getting them away from deeper tissue and protecting itself. There is almost immediately a release of growth factors. And what those growth factors are doing is they're saying, things are destroyed here. We need to fix it. Hey, you fibroblasts, you little cells that make scar tissue, get your asses in here and start plugging this thing up. So the little chemical signals that do that, and that happens right away. There is going to be some peripheral damage. You know, we talk about peripheral damage. War has become sort of popular these days. And regardless of whether it's a good war or a bad war, in a military sense, armies accept the fact that if you're going to defend a town or a city or a country or something like that, some of the activities that you're going to do in protecting those borders are going to damage things that you didn't really want to damage. And that's peripheral damage. The same thing happens in the body. There will be tissues destroyed that are viable, but it's more important to keep out the invaders. That's a normal healing process. And there will be some pain. We talk about our duty and the importance of defending ourselves against pain, of defending our patients against pain. Look, if you didn't have pain, you wouldn't survive beyond infancy. Because pain is what tells you that there's something broken and you better lay off, and you better deal with that injury. I'm not saying pain shouldn't be treated, but pain is a friend of ours and one of the reasons why we can function. So then what happens, all those cells, and I'm going to use the term fibroblast frequently. Fibroblasts are basically kind of random cells that are kind of in the body there, and they sort of, they make a little bit of tendon, and they make a little bit of tissue, and they make a little bit of skin, and they make a little bit of this, and they make a little bit of that. And there are, in an injury, there are chemical signals that say, you're going to go be a tendon. You're going to start working on skin. You're going to start being part of this muscle. You're going to form a blood vessel. It's a very intricate and lovely, a lovely system. And part of that is a process called granulation. Okay, so everybody knows what proud flesh is, what we call proud flesh. Okay, you see a wound, 3 or 4 or 5 days old, a week old. You look at it, it looks kind of all lumpy bumpy. It looks kind of like a really miniature piece of cauliflower, right? Looks granular, hence the name granulation tissue. Everybody, oh my God, proud flesh, terrible stuff. No, that granulation tissue needs to be there. That is how the body fills up that hole, and all those little lumps and bumps there are little tufts of fibroblasts with little blood vessels in them. And those blood vessels are full of immune cells. I love to see granulation tissue because I know then that I really don't need antibiotics, that the body's protected. It now has a barrier because there's nothing going to get through that phalanx of white blood cells with all the weapons that they have to void off infection. And so what happens then is the tissue gets filled up with granulation, and then the skin from around the outside starts to go through a process called epithelialization. Epithelium is the stuff on the outside. It's like skin. And what happens is you've got the wound filled up with granulation. The little epithelial cells start marching over the top and start closing the wound up. And eventually, some of those cells are what are called keratinocytes, and those are the ones that are able to secrete the dead outer layers of skin that, when we look at each other, that's what we're looking at, basically, is a dead product of keratinocytes. That's what's on the outside. And that's what makes skin durable. It protects you from UV radiation. It protects you from cold. It protects you from pressure. And so that's how the process works. And then gradually there will be a process of remodeling where the hole got filled up. It kind of got covered over. But now we want to make it look kind of new. Like it used to be. We want to make it like it was. And that's where remodeling occurs, and that's a much slower process. The stresses on the tissue tell the cells that are there, well, I know that worked okay for you to be laying this way, because we had to fill up that hole, but really the stress runs that way, so maybe if you migrate over like this, you'll have skin that looks normal, tendon that looks normal, muscle that functions normally. And that's basically how the process works. And then finally, there's a process called apoptosis. Apoptosis, in my lifetime, that's a process that was discovered. Programmed cell death. Only one thing I know, I'm going to die. You're going to die. My donkey's going to die. That's how it works. That's all I know. And one of the reasons for that is apoptosis. When cells are born, when they develop, there's a clock running in there. And eventually that cell is going to self-destruct. happens to every cell everywhere. It can be sped up if that cell is redundant and the body doesn't really need it. But sooner or later, those are going to go away, and as that happens, the tissue begins to look more and more normal. One other thing I wanted to mention is this concept of glycocalyx. So if you look at a wound, there's goop on the top of it. And that goop is important. It keeps the healing tissue moist. It nourishes the outer layer of fibroblasts as the wound heals. It contains compounds that kill bacteria. Conversely, it can also act as a home for bacteria and as a culture medium. So it's kind of good and bad. And it can be sticky and it can trap dirt, which are little homes for bacteria and fungi and other organisms. But that's the stuff on the surface. So, as I said, a lot of that granulation tissue. You know, your typical dorsal surface of the hawk wound here. We're cleaning this up out, out in the field. For a change, we don't have headlamps on. But I want to see that. I'm very happy with that. I wish the wound was smaller. That's kind of a big, nasty wound. But that means it's healthy. The body's doing what it's supposed to be doing. Again, it fills the holes. It stabilizes the tissue so the skin isn't slipping back and forth all the time. When that happens, wounds can't heal because the junctions in between those fibroblasts get pulled apart and then they have to reform. It's the matrix that the epithelialization is going to occur over. It nourishes other cells and, as I mentioned, keeps out invading organisms. Now, just because something looks pink and gooey does not mean it's granulation tissue. And this is a good example here. That is a sarcoid. That's not granulation tissue. That is a tumor. So, beware of the healing wound that has been looking the same for like 3 months. I would be very concerned that it might be a sarcoid. And because of the animals that we deal with, donkeys in particular, are super sensitive to sarcoids. And particularly in tropical and warmer areas, when we work in eastern Nicaragua in the tropics there, I mean, we'll see mules that have 30 sarcoids on them. And I don't mean sarcoids. I mean big sarcoids. They're just covered with the darn things. And it's characteristic of donkeyness and by extension, muleness. So you do have to watch out for that. Wounds don't normally just kind of stop and arrest and sort of stay gooey. That's probably something different. What about scars? Okay, this is what's called a keloid scar. And what that is the wound is healed. There's been epithelialization, but the keratinocytes, the skin cells, have not been able to grow over it because the wound was too large and it took too long for it to heal. This is unsightly. This animal's probably going to live with that. Not my favorite, and you wouldn't want that obviously in a show horse, but it's not really affecting function. It makes a difference about the anatomic location. Wounds below the knee and the hock in all equines tend to do that. Why is that? Because they lack readily available blood supply. As you probably know, there is no muscle in the horse's legs or the donkey's legs below the knee or the hock. You have skin, you have tendon, you have bone, you have ligaments, cartilage in the joints and so on and so forth, but there's no muscle. And that's what that does, is it allows these animals an extreme amount of kinetic efficiency. They don't have to throw a bunch of muscle out there when they're galloping along. the muscles of the upper body throw the lower legs forward. I'm not going to go into the kinetics in detail, but suffice to say, the less weight that is involved in that, the more efficient that process is. Okay, as a result, you know, if you think about a bear or a human or something like that, I can do all these fancy things with my fingers. And that works fine for primates because we evolved to climb trees and do all that kind of thing. But that isn't how horses and donkeys solved the problem of survival. They survived it by being able to run. And you're more efficient if you're not packing all that extra muscle. Well, the problem with that is muscle is where a lot of the blood supply comes from. So the wounds tend to heal more slowly there. There tends to be more granulation tissue because of increased irritation and delayed wound healing, and that's why you tend to get these scars like this. The other thing is many of the wounds that we get on lower legs are in areas of high motion. With motion, what happens is as the body tries to heal, the cells get pulled apart and they have to undergo the same process again. They get pulled apart, and as that happens, wound healing is retarded, and so you tend to get this inability of the skin to cover the healed tissue. What makes for good wound healing? Blood supply, low blood supply. Nutrients. They come from muscle. I've seen wounds on horses' chests that were literally so big I could stick my head into them. And full of maggots. Take a hose the maggots out. You go back and look at that horse a couple of months later, you got to brush the hair back to find a scar. Heal up 100%. That's because there's a lot of there's a lot of blood supply in that skeletal muscle in the pectoral region. The animal needs to be immune competent. If an animal is immune incompetent, it's not going to be able to utilize those white blood cells to fend off the invasion of microorganisms. If you can immobilize a wound, or if it's in a part of the body that just simply doesn't move very much, it's going to heal faster because the little fibroblasts can go over there, they can shake hands with their little buddies on the other side, and they can, you know, do their little fibroblast thing, and they can fill up with granulation tissue. They don't get torn apart, so the healing process moves along smoothly. And then the animal needs to be in generally good nutritional status. Horses with bad teeth, horses that are undernourished, don't heal well. And it's quite often a problem with older horses that have, you know, horses that we would call poor keepers, very old burros that we might call poor keepers. They're not going to heal as well. Things that retard healing is sort of the opposite. Inflammation is good at the start, but after a while, too much inflammation is a bad thing. If your white blood cells are going in there and they're throwing toxins around and they're blowing this up and they're blowing that up, pretty soon they're going to get done blowing up bacteria and they're going to start blowing up other cells. So that's going to retard healing. We mentioned motion, infection, bacteria produce, they can directly infect cells, but they can also produce toxins that can damage them. And furthermore, they compete for nutrients. So cells don't grow as well if the nutrients are being stolen by bacteria. They can affect local blood supply and can have whole body effects too. And so lack of nutrients, either because the animal is poorly nourished or because there's little blood supply, again, is sort of the opposite of the slide that we just showed. Dirt, foreign material, not ideal. It acts for a nidus of infection. It's irritating, which increases inflammation, and therefore is going to retard healing. The body's pretty good at getting rid of this stuff, but when there's extreme amounts, of foreign material. It will certainly slow healing, cause pain. And I want to point this out. Do no harm. I'm going to harp on this a little bit because this is something that people don't think about. Caustic wound treatments and poorly placed bandages are going to do that wound more harm than good. Make it better. Don't make it worse just because you feel you have to do something. Doing something isn't necessarily the right thing to do. Sometimes doing nothing is better. So, you know, here's a chronic painful wound that doesn't look very big. It's for a little tiny wound on its coronary band. That's what was under the hoof wall. I've seen this in donkeys, particularly where I used to practice up in Mendocino County. We got a lot of redwood around, redwood splinters. And that splinter gets down underneath the coronary band. So beware the small wound that creates more pain than it should. There's probably something else going on. Kind of covered that. Here's a wound that we see quite a bit. Now this is a saddle sore. It's right on the withers. And there's a couple of aspects here. This is a nice healthy granulation bed, but this scab here in the middle and this exudate is because that wound is floating back and forth over the underlying tissue. There's too much motion and it's just not going to heal. So underneath this, there's a big pocket of debris, damaged tissue, contains bacteria, so that's not going to heal. So here's an approach to that. We're going to debride it. That is, we're going to remove the overlying tissue. We're actually making the wound quite a bit bigger. But we're going to take out all that infected material that was underneath that surface. There it is right there. And then we're going to protect it with, in this case, and I'll talk about that a little bit more in a minute, with what's called a wet to dry bandage. What that bandage is doing is it's stabilizing the tissue and it is actively absorbing debris and exudate. Exudate, I'm sorry, I need to explain that. Exudate is the serum, the dead white blood cells and the bacteria that comes out of a wound. We want to remove that, and this is one way to do it. What we've done here is we put a couple of little sutures in the skin and basically just laced it up like a shoelace. That's called a stent bandage. They're very effective. It did not require anesthesia. Lidocaine, 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 stitch, stitch, stitch. Same thing on the other side, and then just kind of laced it up. Okay, wet to dry bandages. This is one of my favorite treatments. It has several advantages. One is it's cheap. Another advantage is it's pretty hard to screw up. And it's effective. And basically what it does, you take gauze, you put a best sterile but at least clean liquid on it so it's wet. You can put very small quantities of a disinfectant in it, and that could be some sort of antibiotic. I use like a 2% solution of chlorhexidine, which is Novosan. And you put that in direct contact with the bandage. This is not a Telfa pad. I want the stuff coming out of that wound to stick to that bandage. And then when I remove it, I pull away the dirt, the dead bacteria, the dead white blood cells, and the other inflammatory products that is retarding healing in that wound. The only thing about it is it is somewhat labor intensive, and if you're going to do wet to dry bandages, you need to change that bandage every day. That needs to be pulled off the wound every day. When you bandage, when you not bandage, this is a horse with a ugly, large subcellular abscess, which is basically a wound. But that's pretty happy looking granulation tissue there. Got a nice pink color to it. We're kind of just sort of cleaning it up a little bit. And the reason I'm going to bandage that is that if I don't, there's no protective covering over that. That horse goes out there, steps on a rock, it's going to cut it open, and then it's going to go through hemostasis, inflammation, the whole bit all over again. So bandaging that is going to promote healing. This is what happens when a bandage goes wrong. That was a bandage that was placed by a client on a foal's leg without adequate padding underneath, and it actually enlarged the wound because it crushed the underlying tissue, decreased the blood supply. What happens when you decrease blood supply? You retard healing, and that's after we clean it up, but that was a permanent scar on that foal's leg. So if you're going to bandage things, adequate padding and be able to change it. It does help, bandages do help to reduce motion, again, when properly placed. Adequate padding, absorbent cotton works fine, or you can buy those cotton sheets. I know everybody likes to put diapers on everything, you know, okay, fine. The thing I don't like about diapers is unless you're trying to hold moisture in something, I want something that is going to absorb that moisture and get it away from the wound. If there's going to be moisture there, I want it to be moisture that I made, that's sterile and clean. It's got a little bit of disinfectant in it. That's why you're going to use a wet to dry bandage. You make perfectly good bandage with nothing more than gauze. You don't need vet wrap. If you bandage properly, yep, duct tape works just fine. It's cheap and it's effective. I'm going to talk a little bit about it. This is a spider bandage. Back in the late Pleistocene, when we didn't have vet wrap and so forth, that's just nothing. A flannel probably works best. This happens to be a woven cotton huck towel, but a flannel probably works best. Cut a bunch of tails in it like that. Start at the top of the wound. Square knot, and then as we go down the bandage, we're going to tuck the tails under the next layer, and you end up with something like that. It's a little sloppy there at the bottom. But these work really nice, and you can use them over a knee or a hock because you can adjust the tension so you don't rub on that accessory carpal bone or the back of the hock. And we use them frequently when other bandage material isn't available. You can make 2 or 3 of those. You can wash the darn things. So instead of putting $10 worth of elasticon and cotton and whatnot into a bandage, these things cost next to nothing. They do need to be changed every day. Because just like, you know how if you wear your jeans for a couple of days in a row, how the knees get kind of stretched out, well, that's going to happen with this too. If there's something I want you to take away from this talk, that's it. How do I decide what I'm going to put on a wound? I look at it and say to myself, I say, self, are you going to put that in your own eye? I ain't going to put it in my own eye. I'm going to put it on a wound. Yeah, but what about the wound that? Yeah, well, what about the wound that? If you wouldn't put it in your eye, don't put it on a wound. Why is that? Well, there are plenty of things that will kill bacteria. Plenty of things that will kill bacteria. You don't want to kill all the other cells too. And that's precisely what's going to happen if you use caustic substances. So, gentian violet, no. Hydrogen peroxide, and this is very, very dilute, no. Silver sulfanilamide is great. I would put that in my eye. It is broad spectrum, and it has been objectively proven not to negatively affect fibroblast migration. Triple antibiotic, which is Neosporin. Very dilute chlorhexidine. Both chlorhexidine and iodine do retard fibroblast migration, and strong concentrations of that do not kill more bacteria. They just damage cells. And believe me, I've been a sinner. I've put enough strong iodine on wounds to fill up this wound so you guys had all drowned. But when I stopped doing that, the wounds healed better. Furious ointment inhibits fibroblast migration. You can put that on there if you want, but you're inhibiting fibroblast migration. Now, in a really dirty initial wound, it probably doesn't make a lot of difference. You're probably not really hurting things. There's so much dead tissue and debris there, it probably doesn't make any difference. But long term, if you keep doing that, you're only slowing down wound healing. Honey, actually, I wouldn't mind a little bit of honey in my eye. I'm probably not going to go way out of my way to do that. Works well. It's antimicrobial. How many bees do you know that keep their honey in the refrigerator? Well, there's a reason for that. Honey is full of little tiny glucose molecules. Any bacteria that tries to live in that just gets all the water sucked out of it and it dies. And there is objective proof that honey improves wound healing. And it doesn't have to be Manuka honey either. It does not. Yeah?
Is the Neosporin a yes or a no?
Yeah, oh, I'm sorry. Okay, I should simplify that. There are two commonly used ointments that are objectively proven to not retard fibroblast migration, and that I would put in my eye. One of them is triple antibiotic, which is actually an ophthalmic ointment, and that's Neosporin. It's neomycin, polymyxin, and bacitracin, and the 3 antibiotics. And the other one is silver sulfanilamide. Okay. Ophthalmic ointments, when I do skin grafts, I usually use chloramphenicol ophthalmic ointment. Again, I can put it in my eye, I can put it on a skin graft. The other things that work quite nicely that I will use frequently, is pretty inexpensive, are bovine mastitis treatments. I mean, it's not putting it in, I would put it in my eye, but if you can put it in the mammary glands, you can probably put it on a wound. And they're kind of nice because they've got a little applicator tip on it, and you can put it into a hole and flush with them. So they're pretty nice. To suture or not suture. That's a gooey wound. It's got exudate in it. It's not very clean. And you're only going to make that worse if you suture it. Let it drain. It's a nice sharp cut. And then once the body has debrided itself, gotten rid of those bacteria, and filled that with granulation tissue, that's going to heal up and you're not going to have a scar there. Because it's up here on this donkey's shoulder. This is a brand new cut. You can see it just looks like a steak right there. It's an animal that went through a fence, because it wasn't a very good fence. While we were working some colts to castrate him, cut itself like that. A little bit of cleaning that, closing that right away. That thing healed up in 2 weeks. Had we chosen to not do that and left it like this, it probably would have healed up in about 3 weeks or a month. So that's what that bought you.
If you hadn't sewn that one up, would you have gotten a much bigger scar?
No. The reason you get a scar is infection, motion. This was on the top of a horse's rump. There's not a lot of motion there. It's good and clean. Infection's unlikely. And removal of large masses of skin. We're all born, I know you can regenerate hair follicles, but in general, we're born with all hair follicles we're ever going to have, and that's true of horses too, and donkeys. And so, if you remove a large mass of skin, yeah, you're going to get a scar, but this is a sharp slice. So that's going to just pull itself right together. Very, very. very nicely. Large chunks of skin removed. Somewhere down the line, you're going to look at a bigger scar, or you're looking at a skin graft, which is beyond the scope of this presentation. But skin grafts are not that hard to do. They can really add to wound healing. I'm really big on skin grafts. This is a wound here that's open. There's a chunk of stuff hanging down here. Don't cut that off. And here's why. I'm going to take and pull that up so it doesn't form a little finger sticking out there. I can't close that thing all the way. There's no way. If you pull on suture material really hard, it just tears through the skin and you just make a bigger hole. But by kind of putting this over to the side there, what that does is it covers this tissue with what it wants to be covered with, which is skin. Okay, so this loses blood supply and dies. Big whoop. You get a piece of leather there. Once it's all dried up, cut it off with a pair of scissors, or it'll fall off. You can take wounds, and you can take skin off of another horse and put it on that wound as a graft. It is not going to stay. It's going to dry up and fall off in about a week. But there will be a measurable increase in wound healing and contraction. That's research that's been done numerous times. Don't cut skin off. You know, and yeah, maybe it's going to dry up and fall off, and maybe it won't. You know, is it going to dry up here, or is it going to dry up there? Well, I don't know, and I'm not going to know until that process happens. So you might as well leave it there. You might as well save the hair follicles. This happens to be a drain. It's called a seton. Seton is a drain. Goes in one side and out the other, and you tie a knot in it. That's what that's why that's there. Here's a wound, nicely healed up because the horse impaled itself on this with a drain at the bottom. Looks all nice. 2 weeks later, that whole thing's wide open and there's just pus pouring out. So probably closing it up made the owner feel better, and we left a big enough hole at the bottom that didn't really hurt the horse, but it didn't really improve healing all that much either. And finally, I want to go through one thing because I think this is kind of a nice case and demonstrates what can happen with proper wound management. This is a donkey, Guayaquil, Mexico. This big nasty sore on its leg. And again, it was anesthetized because it wasn't really thrilled about us messing with that leg, and we need to get a good look at it. Here's a piece of polypropylene rope that was tied on there as a hobble. Okay, and basically it just cut right through the skin, and the thing went all the way around the leg and cut off the blood supply of the skin there. Okay, nasty wound. We radiograft it, and I thought that when we probed this, I thought, oh my God, it's in the pastern joint. That's an open joint. This is really a bad thing. But we were able to get a radiograph of it, and there's the fetlock joint, sesamoid bones there. There's the pastern joint there, and the coffin joint there. That's a hole in the middle of the bone. And what had happened is that piece of polypropylene rope had put pressure on that bone. The bone had reabsorbed, and you had this big this is a gap in the bone right there, and you can see how the bone is trying to stabilize itself by all this excess bone growth here around the outside. And unfortunately, I don't have a. This is the long pastern bone. If you compare it to the short pastern bone, they kind of look like the same. So this bone here should look like a longer version of that, basically. Okay. I think what happened is that this grew into the tissues. The blood vessels were able to just grow around it about as fast as it was killing the blood vessels underneath. And otherwise, the donkey's foot would have fallen off. This is 3 days with nothing but wet to dry bandages. Okay? 4 days. Happy, healthy granulation tissue. Oh, we are just, fibroblasts are just having a good time there. That's just, I love to see that. 1 week with a fly on the surface, of course. But basically, we're changing wet to dry bandages every day, and very happy, and the wound's half the size. Okay, I'm not worried about that fly. Nothing that fly's carrying is going to get through that granulation bed. 2 weeks later, it's already starting to epithelialize. And this donkey was dead sound. Just was fine. I didn't put in the video because I can't ever get the videos to plan this, but we got a very nice video of a student just walking this donkey along. It's like, you know, big deal. My leg's fine. I'm a happy donkey. So that and probably total cost on supplies to treat that leg might have been $12 or something like that. I don't know, it wasn't much. And we never put them on antibiotics because we didn't need to. It was well flushed out. The granulation tissue covered everything up. The bone had already covered itself with granulation tissue, and although it was exuberant, it was healthy. And so it did just fine. Sarcoids are a type of skin tumor. A lump on an equine is assumed to be a sarcoid until proven otherwise. Okay, they're very, very common, and they're very common in mules and donkeys. There's several different kinds of sarcoids. Some of them have no skin covering like that one, you know, so they're ulcerative. Others have a skin covering, so they're just a lump. So a lump, you don't know what it is, and particularly if it looks like, oh, that's, you know, so-called exuberant granulation tissue or proud flesh, and it's not going away, and you've treated it, be a little suspicious. The causative agent is unclear. You can get DNA from bovine papillomavirus out of sarcoids, but if you take bovine papillomavirus, which causes warts in cattle, and put them on horse skin, you don't cause sarcoids. So exactly how it happens is probably complicated. But sarcoids have been, again, beyond the scope of this lecture, but they've been the bane of my existence. So that and laminitis. Was talking about habernomyosis. That is sort of the caveat. I'm hoping this guy isn't carrying microfilaria from habernomyosis. But you can slice and crawl all over that, and it's really not going to hurt anything. I mean, they look icky and they annoy the animal, but they're not really going to hurt the wound that much. So I take a handful of repellent or swab and just smear it on there, and that'll keep the animal from being irritated. It probably isn't going to hurt the wound very much. If I was in India, South Asia, where they have Cochlymyra hominivorax, which is the screwworm fly, it's been eradicated from North America, I would be more worried about it because the maggot of the screwworm fly will actually eat live tissue. But Musca domestica, which is the common fly that we see here, the maggots only eat stuff that's dead anyway. In fact, you can buy maggots to treat wounds with because they do very good wound debridement. You can buy you buy sterile maggots. Like, why do you need a sterile maggot? But you know, you can get them a lot cheaper than that. Yes.
Can you use sterile water or normal saline?
Yeah. Normal saline would be preferable, and the reason is that sterile water is hypotonic. So if you have too much salt or too much solutes in a fluid, it tends to suck the water out of cells and kill them. If you use something that's hypotonic, it tends to go through the membrane into the cell. It swells up, and so I would prefer something like saline. But if what I have is distilled water, which is very close to sterile, I would use that. And the reason that you can get away with it is there's usually enough goop on the wound that in the microenvironment of the surface of that wound, things are kind of gotten pretty normotonic or isotonic. Isotonic, which means the same number of solutes in the solution as there are in cells, so it's going to hurt it. So that would be an option. I've even had abdomens that I flushed out with drinking water, an open abdomen, and they've done fine. But that would not be my choice if I had something else available. There's several kinds of iodine. There's iodine crystals. If you put those crystals in water, you have what's called Lugol solution, which is an aqueous iodine solution. If you put them in alcohol, you have tincture of iodine. Okay, those are all very caustic. If you mix iodine with ethylene diamine, it becomes an organically complexed iodine, and that's what we know as betadine. It's actually, the technical term is providone iodine, or EDDI. And the importance of that is that is much less caustic to tissues. Having said that, you want to use it in a 10% dilution at the most, because you don't buy anything by having a stronger dilution. It only becomes caustic at that point. I would probably, yeah, and actually I would probably, iodine I would use if I didn't have anything else, and I would probably dilute it to like 1%.
But the 10% betadine would...
Yeah, 10% betadine, I use that for sterilizing instruments. But you will get better wound healing if you stick to the basic principle, which is all together now. You can put it in your own eye, don't put it on a wound. So thank you very much.